Alrighty, so I'm gonna get through all of these in a good matter of time of 3 to 8 minutes. Alrighty, so we're gonna start off with the foundation of American Medical Association, also known as AMA, in 1847. So the AMA was founded to promote the science of medicine, raise standards for the medical education, and protect the rights of physicians. This is important because the AMA played a crucial role in shaping medical professionalism and has a influence health policy in the U.S. for over 170 years. Wow. Okay, so number two, the establishment um, of Food and Drug Administration, also known as FDA. This was created in 1906. It's a super important day because the Alphas, the fraternity that I'm a part of, Alpha Phi Alpha Fraternity Incorporated, was also founded in 1906. Woo. Okay, but no. The FDA was established to regulate food, drugs, and cosmetics, ensuring that they were safe and accurately labeled. This is important because the creation of the FDA helped protect public health by preventing unsafe and fraudulent products from reaching consumers and is essentially for outgoing medical advancements for drug safety. Moving on to 1955, the invention of the polio vaccine. Dr. Jonas Salk developed the first effective polio vaccine. Why is this important? This is important because the success of the polio vaccine led to dramatic decline in the polio cases in the U.S. and worldwide, making a major victory in public health and vaccination of science. Woohoo! That was in 1955. And then we have one more in 1955. In 1955. Well, 1965, the creation of Medicare and Medicaid. The passage of the Medicare and Medicaid programs as part of the Social Security amendments under President Lyndon B. Johnson. This is important because the legislation expanded healthcare coverage to elderly, disabled, and low-income Americans, changing the landscape of U.S. healthcare, and providing a safety net for millions of vulnerable populations. And then after that, we also had in 1993, the National Health Insurance Act, the Clinton Plan, proposed by President Bill Clinton. And this plan, it was aimed to provide... Oh, snaps. Let me back up. I'm sorry. We're going to 1993. The National Health Insurance Act, the Clinton Plan. Yeah, that's what I was on. So, proposed by Clinton, provide universal care and coverage throughout a system of managed competition. This is important. While the plan ultimately failed to pass, it spurred ongoing debates on healthcare reform and laid the groundwork for future reforms, including the ACA. And then we go to 1996, the passage of Health Insurance Portability and Accountability Act, also known as HIPAA. HIPAA was enacted to improve the portability and accountability of health insurance coverage and protect patient information. This is important because it set national standards for the protection of health data, ensuring that healthcare information is kept confidential and secure, which is critical in the modern digital age. Then we're going to head to 2003. And 2003, we had the passage of the Medicare Prescription Drug Improvement and Modernization Act. The Medicare Prescription Drug Improvement and Modernization Act created Medicare Part D, offering prescription drug coverage for seniors. Why is this important? The expansion of Medicare greatly improved access to medications for the elderly and was a major step in addressing the rising cost of healthcare. Then we go to 2009, the first U.S. stem cell clinical trial. The first clinical trial using human embryonic stem cells were approved in the United States. This event marked a significant achievement in medical research, offering new hope for treatments for diseases such as Parkinson's and Alzheimer's, and highlighting the intersection of healthcare and cutting-edge science. So then we're going to go to 2009. In 2009, the first year, and then we're going to jump to 2010. My apologies. That was 2009. In 2010, the introduction of the Affordable Care Act, known as ACA. The ACA was initiated by President Barack Obama, aiming to reduce the number of uninsured Americans, improve healthcare quality, and reduce healthcare costs. Why is this important? The ACA expanded Medicaid, implemented protections for people with pre-existing conditions, and provided subsidies to make health insurance affordable. It's one of the most significant reforms since Medicare and Medicaid. And lastly, in 2014, the development of the Affordable Care Act's Medicaid expansion. The Medicare expansion under the ACA allows states to expand Medicaid eligibility to millions of low-income adults. Why is this important? The Medicaid expansion significantly increased access to health care through the implementation was left up to individual states, leading to ongoing debates over state versus federal control in healthcare policy.